Welcome to Uncommon Knowledge. I'm Peter Robinson. Be sure, by the way, to follow us on Twitter at twitter.com/UNC Knowledge. Twitter.com/UNC Knowledge. You can send us your comments, questions. We'd love to hear from you. A political scientist, David Brady is Deputy Director of the Hoover Institution and a professor at the Stanford Business School and at the Stanford School of Humanities and Sciences. An economist and a lawyer, Daniel Kessler is a senior fellow at the Hoover Institution and a professor at Stanford Business School and Stanford Law School. Today, healthcare and President Obama and politics. President Barack Obama, before a joint session of Congress on September 10th, quote, "The time for bickering is over. The time for games has passed. Now is the time to deliver on healthcare," close quote. In no more than one sentence, is President Obama going to get what he wants? Daniel?
Probably not exactly, but where the bill is going to come out in the end, nobody knows.
David?
I think it's unclear exactly what President Obama wants. He'll get a bill, so he'll sign it, so maybe that is what he wants.
All right, segment one. Something about this looks familiar. Here's the scene. A Democrat has captured the White House. Democrats control both houses of Congress. A big majority of Americans say the government should guarantee health care. And I'm talking about 1993, not 2009. In 1993, President Clinton's health care proposal, despite that scene, failed so spectacularly that not a single version ever came to the floor of either the House or the Senate for a vote. Why did Clintoncare collapse, David?
Well, it collapsed because the policy was too complicated. It was held by Mrs. Clinton in secret hearings, and it was too far to the left. So if you really think about it, what matters, when people normally think about the legislative process, they think, who's the 218th voter in the House of Representatives?
Who's smack dab in the middle?
All right. Who's the 50th senator? The way to really think about it is who's the 60th senator on the conservative side. So if you have a policy proposal that's too far left of that, a filibuster can move the policy toward the right.
Okay, now take a moment. This actually is important. The number 60, not 50, and the importance of the filibuster. Why does that shift the decision-making power in the Senate off to one side of the spectrum rather than leaving it right smack in the middle?
Shifts it off to one side because if you think about getting the 50th vote, if you think about getting the 50th vote, and that policy is too far left or right, and the 40th senator, or the 60th, say the most, in this case, because the policy is a liberal policy, the conservative senator, the 40th most conservative senator, can lead a filibuster, and the only way you can break the filibuster is move the policy more toward him. The Clinton people proposed a policy too far left, and they waited too long, and sort of toward the end there was the Cooper bill, and there was the Chafee, and the Moynihan tried to cut the coverage to bring the bill to the center, but it was too late and they never got it there.
So we hear over and over again that you've got to aim for the middle of the Senate. That's not quite true. So moderate or smack dab in the middle Democrats won't do. President Obama, to address the present case, actually has to get over to 60 senators, which means he has to bring along a couple of conservative, or a handful of conservative Democrats.
He has to, as you think about it like this, Senator Baucus of Montana is right about in the middle. But ideologically, he's not enough. You've got to go 10 persons to his right to get 60 votes. And that means, think about, you're looking at Enzi, you're looking at Collins, you're looking at
Collins of Maine,
Enzi of, let's see, where's Enzi from? Sorry.
We'll put it up on the website.
Oh, Wyoming. Enzi's from Wyoming, okay. And Nelson from Nebraska, and Blanche Lincoln from Arkansas. Those are conservatives that they got to have their vote.
Okay. So that's the sort of the mechanical piece of your model in decision making. The model, when I say your model, I'm talking about the paper the two of you wrote on healthcare, also makes a great deal of the condition of incomplete information under which legislators are being asked to cast their votes, frame up their positions and cast their votes. Well, explain that.
Well, the uncertainty of a package of legislation of this size is huge. First, there's the uncertainty about what effect the legislation will have, which nobody knows. And second is, even if you knew what the...
Actually,
go ahead.
You just said that in a very straightforward and calm manner, but that's actually a very provocative assertion. the effect of the legislation, if you ask President Obama or his Chief of Staff Rahm Emanuel, will be to improve health care in the country, will be to cut costs and extend coverage to the uninsured. Those are the effects of the legislation.
Those effects are highly uncertain. We do know that coverage will probably expand, given most of the Democrat bills that are being proposed. By how much? There's a wide range of estimates. How much will it cost? Nobody really knows. The CBO has scores as to what they predict it will cost the government, but how much it will actually cost families is an open issue.
So you are asserting that even though the President of the United States said in his September 10th address to the joint session of Congress, I intend to extend coverage to the uninsured, I intend to cut health care costs, and I will not add one dime to the deficit in doing so, every thoughtful member of that chamber and every thoughtful member of the press covering him knew that it's much more uncertain than that.
As does, I'm sure, President Obama. I mean, speaking in a political arena, you need to speak in focused terms like that. But everybody knowledgeable about this knows that there's a lot of uncertainty. But the uncertainty about the policy's effects is only the start of the problem. Even if you knew what the effects were, it's very hard to know how voters will react, how voters will read those effects. And those two sources of uncertainty compounded with one another mean for a member of Congress interested, not surprisingly, in getting reelected, that they're going to be highly reluctant to back something where they may have a majority in their district or their state who end up worse off because of it, or end up mad or something.
Think 1993.
Yes, go ahead.
In 1993, the Arian Louise commercials. What were they about?
Anti-Clinton.
Those proposals said, if you vote for if this passes, you might not be able to choose your own doctor. And that people thought, and members of Congress are going, gee, could that happen? And even if they thought, not quite sure, how will the voters react if my voting to it, even if it wouldn't happen, because the next election we won't know by that time. So the combination of those two things, and under conditions of uncertainty, you favor the status quo.
Okay.
It's human behavior. You know the status quo,
absolutely,
and you can get reelected on the status quo.
Segment 2. We've been talking about Clintoncare. Let's move decisively to the present moment. Obamacare, 1993 to 2009. President Obama comes into office knowing that Bill Clinton, a very popular president in 1993, got nowhere on health care, and yet President Obama is plowing ahead with it. What has changed? Has public opinion changed? Has health care itself changed? What's different? What enables him to think he can get it?
Well, we think that one of the things that has happened is there's very slightly more people want change. Secondly,
you're talking about the polls.
Yes. Secondly, the Senate is a little further left than it was in 1993. And third, and Dan can speak to this better than me, note that none of these plans were as far left as Mrs. Clinton's, because everybody says, you like your present health care policy, you can keep it. Now that's an important point. So that has changed. So it's not as far left. And the second thing is the Democrats remember 1994 election and what happened when they didn't pass this. And the president didn't keep it all in the thing. He actually turned it over to the House. He's been criticized by some people for saying, why would you let them write it? But the fact is, he's a lot further toward getting a bill than Clinton was, as you pointed out. Not a single committee voted on it. He's already got 2 bills passed in committee, and he's certainly going to have another one in the Senate by the end of the week.
Yeah, I think the Obama administration has definitely learned from the Clinton administration's mistakes along all the lines that Dave suggested. But whether or not they're going to get a bill is still uncertain. And even if they do, it's never going to have everything that they wanted in it from the start. It's going to be a compromised position. And so I think that just the experience of having been defeated in 93 has made the Democrats more amenable to compromise. And so you can already see things like that starting to happen. So I think that works in their favor. I think that healthcare costs are higher now than they were in 93, which militates in favor of reform.
By the way, let me just take one step back. We'll return to President Obama and his plan in a moment. Why does healthcare need to be reformed? Let's just ask the baseline question. What's wrong with healthcare in America? You quote in your article Gallup poll saying that in 2007 and 2008, the number of Americans who rated the health care they receive as good to excellent was deep into the 80%.
Yes.
87% is the number that I recall. So what's wrong?
Well, what's wrong is that we have let costs get way out of control, and there's been a number of sort of nasty side effects from that. The first nasty side effect is people are uninsured. People are uninsured because they can't afford health insurance. The second nasty side effect is flat wages over the past decade or so. The flat real wage growth is due and can be explained entirely due to the rise in real benefit costs, primarily health insurance. We waste a lot of this money. Everybody acknowledges this. There are differences in views about how much waste there is, where the waste is, but whether the fact that we waste money, there is no dispute. And so those factors together are a problem. Is it a quote-unquote crisis? No, I don't think it's a crisis. Is it a serious problem requiring policy reform? Yes, absolutely so.
But maybe not in the short run.
Well,
long run, the costs will, if they continue on, the costs will continue to rise in this fashion.
We could hobble along for a while.
All right,
for sure.
So next basic, thank you very much. That's sort of hurdle question number one. Here's hurdle question number two, in my mind, to understanding the present situation. Before you even begin to get to the details of the legislation, why one massive bill? Why not fix a little bit of this here and fix a little bit of this there, which is, after all, the way the Congress of the United States mostly addresses problems. It'll try something here, try something there, wait, see what the... And President Obama is not doing that.
It's not clear to me that that's not the way we're going to end up in the end anyway. I mean, of course, from the Democrats' perspective, they've got an extremely charismatic leader, very high approval ratings. They've got a Democrat...
Dropping. They've dropped by a third, at least, since he took the oath of office.
It is inevitable that the honeymoon would slowly phase out, but they have control of both houses of Congress. They're coming off a big economic crisis that has only enhanced people's support for Democrats.
You're constructing an argument saying they're doing it in one gigantic bill because they can.
Absolutely.
I want to know the motivation. Why do they think they should, David?
Because the campaigns, if you think about, in my view, there's campaigning and governing. And campaigning makes you go out and promise things to the core, which in the Democratic Party is left to center. So Mrs. Clinton, you may remember in the debates, and Edwards were constantly hitting Senator Obama up with the notion that, you know, you don't cover everyone in this health care plan, and mine does. And so there was an obligation when you come in, these are the plans I wish to do. And if you're going to do it, you better go big. Because if you go small, the criticism, first of all, Obama's getting a lot of criticism from bloggers on the left as it is. Mm-hmm. But if you went smaller, right, if you went smaller, it would be even worse.
That's true.
And I think Dan's right. The end process, it's not clear the end process won't be more like that piecemeal approach.
Let me ask you both to address this one briefly because we're at the end of the segment. But it's a good question. And it comes from an uncommon knowledge viewer called Lance Cahill, who sent it in via Facebook. He writes, in 1976, the health economist Victor Fuchs wrote in the Journal of Law and Economics, which I know is your bedtime reading, Daniel, and he identified 4 characteristics of the United States that make this country particularly resistant to healthcare, to a national healthcare plan. Distrust of government, heterogeneity of the population, we're different kinds of people, a robust voluntary sector, and less sense in this country of noblesse oblige, obligations of the government, than in Europe. You buy that, and have things changed since '76?
I buy most of it, but as Dan and I showed in an article in Health Affairs, there's also a fact that people don't really want to pay for benefits for other people. And
so we had a fifth factor. We're tight-fisted.
Well, Victor, in other work, has agreed with that.
Yeah, I mean, I don't think Victor is saying that we won't have some kind of reform that gives additional assistance to lower and middle income people to buy insurance. I think what Victor is saying is we're never going to have something like the British NHS in this country. And I think that's right. we never will.
You do?
Oh, yeah.
Okay.
And for the reasons that Victor outlined. But that's not what's on the table here. That's not what the president has been proposing. It's not what's in front of Congress. What they're proposing is adding on to our existing system, a system of income supports for people who currently can't afford insurance.
Dan and I disagree on this. I think over the long haul, we will move towards something more like the British system. I think this is the...
You wouldn't deny that's what the left of the Democratic Party... That's what the left and the Democratic Party wishes, isn't it? That's why the government option has been so important, right?
I think so. I mean, I can see no other rationale for the so-called public option, but some people don't agree.
All right. Segment 3, from the politics to the policy. And I want a little historical perspective here, gentlemen. Once again, let me quote President Obama on September 10th, quote, "I am not the first president to take up this cause. Theodore Roosevelt first called for health care reform, and ever since, nearly every president and Congress have attempted to meet this challenge in some way," close quote. Now, he's historically provocative. He's making a point there. And nobody has spent a century calling for the reform of the clothing industry. Nobody's trying to reform auto insurance at the national level. What's distinctive about health care? Why is this an endless debate in this country, going back roughly a century?
Because they're issues of life and death. It's your mother that's sick. How long does she get to live? It's I'm sick. Is my daughter sick? How much should we spend? My personal view is there's no amount of money that shouldn't be spent to keep my daughter alive. And so they're life and death issues, and that matters to people. By the way, the quote of President Obama is that not only it's wrong in the sense that if he got everything he wanted in his bill, the public option, etc., the next president and the next president and the next president would be dealing with the issue of cost of health care. It will not go away until you fix it in some way that you can get the cost down.
Well, okay, let's take that. As witness the National Health Service in Britain, where both sides, once you get national, okay, here, let me ask you this. Mark Stein makes the following point. Once it is accepted that the government is responsible for health care, you transform the entire politics of the nation, and that will forevermore be the dominant issue in the politics of a nation, or very close to the top, as witness Britain. And it becomes impossible, even for the right. Even Margaret Thatcher never suggested dismantling the National Health Service. You trap the entire political system in this endless debate about how to manage it a little bit better here or a little bit better there, and it's a tar baby for an entire politics of a nation. What do you make of that?
I mean, I'm not sure that the British are any more trapped in debating health care than we are, or than other countries like the Netherlands, who have a nominally private system of health care provision with a set of income supports, very much like what President Obama is suggesting. I think that the fundamental issue is what Dave started with. These are issues of life and death. It consumes a lot of real resources, and it's a risky endeavor. It's something that you need insurance for. And once you have insurance, you have the standard economist moral hazard problem. You have cost growth, and everybody is suffering from the same problem. So I'm not so sure that we're any worse or any better politically than anybody else.
Well, the point is not that we debate it any less, but that in Britain, even the right, there is no longer any option for a serious politician to suggest returning a large portion of the healthcare system in Britain to the free market. That's just not a political option.
There's no
in
option
Britain.
in the United States to end Medicare, to end
Or
Medicaid, to
exactly.
end S-chip.
But isn't that a good argument for drawing the line right there?
I think it's a good argument for it, but when I spoke about the disagreement Dan and I
Let's
had,
hear that.
the disagreement is not that we disagree about what we think ought to be the policy, but the disagreement is what's going to happen, in my view, is over time you creep towards something where it is essentially government controlled. And Dan knows the numbers better than I, but already some large portion of healthcare expenditures in the U.S. are from the government.
Yeah, through Medicare and Medicaid.
Okay, well
sure.
then let me put this question to you as a layman. You're an expert in political science. You're an economist. It would seem to me a pretty good argument that the history of the last 7 decades, from the New Deal on, runs as follows. Once a welfare or transfer program is enacted in the federal government, it merely expands. It is almost never subjected to objective tests of efficacy or efficiency. It just keeps growing. And therefore, the only
before Roosevelt, the question was welfare or no welfare. After Roosevelt, the question was how much welfare.
So how can you refute David? If David's suggestion seems to me to be, if Obama gets what he wants, the next president will want more and more and more and more. How can you resist the suggestion that we'll end up with a national health service?
Well, I don't necessarily resist the suggestion. I don't think it's predetermined. I do think that the evidence is that government programs tend to expand more than they tend to contract. I don't disagree with that. But on the other hand, there are examples, for example, welfare, the canonical welfare, where President Clinton did contract it significantly.
I beg your pardon, who contracted it?
President Clinton and the Republican Congress.
And he signed it the third time the Republicans in Congress sent it to his desk.
Very true.
He signed it. Yes, exactly. However, let's keep the...
That's true, but he signed it.
All right. Daniel Kessler, writing, and a couple of his colleagues, writing in the Wall Street Journal recently, the president has made two simple promises. First, his plan will benefit everyone who has health insurance, who already has health insurance. Second, his plan will not add to the nation's yawning budget deficit. Both claims are essentially false. Why won't the president's plan benefit people who already have health insurance? As briefly as you can.
As briefly as read the Wall Street Journal piece. No,
not quite that briefly.
There are basically two reasons. The first reason is that the expansion in demand for health care because of the expansion in coverage is going to increase everybody else's cost of insurance. It's a standard demand and supply analysis. Upward sloping supply curves mean that when you expand demand, prices rise. Simple as that.
So Obama's plan will slosh money into the system, increasing demand, but the supply is over at any given moment fixed. It takes decades to add doctors and hospitals.
It will take some time.
All right.
That's point number one. Point number two, why else might it not benefit people who have insurance? Well, because they're mandating all different kinds of coverage in virtually all of the plans that are being batted around, that's going to mean that the kinds of coverage that you can buy, that you might want to buy to help keep the premiums down, some of which are not going to be available anymore. They'll just be mandated out of existence. That's exactly the wrong thing for Congress to be doing. Now that cost growth is hurting people so much, what we need is more innovation in benefit design, not less.
David, President Obama, quote, "I will not sign a plan that adds one dime to our deficits, period," close quote. You buy that?
No, I agree with what Dan said. Technically, though, he's correct in the sense that when you do a reconciliation budget, the language of the budget is it says that over the next decade, 10 years, the budget, these costs, what the concerns will not go up by over $1 billion.
And you wish to subscribe in public on television to that fantasy?
Technically, everyone who uses reconciliation, including President Reagan, said exactly the same thing. So technically it's correct. Actually, I agree with Dan. But the fact is, presidents can go on and say, under the technicality of reconciliation, turns out 3 years down the road, doesn't quite balance out, it's okay.
It's somebody else's, well he hopes he's still in office.
Yeah, right, exactly.
So why is that a whopper?
I think the most egregious piece of that sort of won't add to the budget deficit claim is that much of the savings, much of the funding for the insurance expansion is to come from Medicare cuts in Medicare reimbursement. Well, every year Congress tries to cut Medicare reimbursement, and every year Medicare spending goes up. So to claim that you're going to get real dollars from legislated, mandated Medicare reimbursement cuts, it's just not true.
It's a budget gimmick. You say, the budget is we're going to cut Medicaid, so it won't. But then what happens is Congress won't cut it.
Exactly.
It's like you may wonder how the AMA suddenly came around to support the bill. There was a proposed 20% cut in fees to doctors. Suddenly, that wasn't in the budget. Suddenly, the AMA thought, not such a bad plan.
All right. Segment 4, what should be done. Now I want to know what kind of health care reform David Brady and Daniel Kessler would advocate under two different conditions. The first, unconstrained ability to implement your plan. So if you were designing American healthcare from scratch, if I could just wave a wand and make you emperor for a day, David and Daniel, what would healthcare look like in this country?
Well, Dan's written a book on this with John Cogan, so you should start
The
with
name of the
him.
book is?
Healthy, Wealthy, and Wise.
All right. What would it look like if you could have your way?
If I could have my way, I would have something that looked similar to the American system, but with better incentives in it and with more support for people at the lower end of the income distribution. But the key element... Better incentives for people to choose. Provided by the federal
government, or?
No, better incentives provided by private markets for people to choose cost-conscious insurance options that got them appropriate care at reasonable cost, which we do not have today, primarily because of the tax incentives we all have to overconsume.
And the tax incentives, would anybody here like to give us a couple of sentences on what Milton Friedman saw as the original sin of health care?
The original sin of health care, I don't know if this is what Milton said, but certainly from our government or policy perspective, the original sin was making health insurance you get through your job excludable from taxation.
Right. That's Milton's position, certainly.
Yeah. Well, right. Milton was 100% right, because that, when added up across all the people who have employer-sponsored health insurance, which is most people in this country, means that none of us are really concerned about the cost, or rather, we're only concerned about the cost to the tune of 1 minus the tax rate.
So, David, obviously the correct thing to do is to repeal that provision, which dates from the Second World War.
Exactly.
And has been distorting the healthcare market in this country for 6 decades now.
Exactly. And which president would you suggest to do that? Which
leads me to the second set of conditions under which I want to examine you, which is the constrained condition. You are now an advisor to President Obama, or let's say to a Republican who's putting together his policy positions with the thought of challenging Obama in a couple of years. As a matter of practical politics, which after all is what you've dedicated your career to examining, what can be done and what should be done? Where is the intersection?
I would say that the president has to say, the kind of President Biden, but I'm going to say, look, you have to set the terms of the debate. You have to say that over time this is not sustainable. And so but I'm going to, in the sense Jack Kennedy would toss ideas out, say this may not pass now, but you have to consider it. And the first and the most egregious, the problem is, I think the first thing is to eliminate the tax break given to employers that we all get, because that works against each of us choosing a policy where we make choices based on cost. And until you have that, until you have citizens, consumers, making choices based on affordability and making their own trade-offs, then you're not going to have any possible reform. So given that the healthcare system isn't going to fall apart in the United States for a few years, I think this is an education process. I think it's already started with McCain pushing this issue. Democrats at one time even thought about paying for some of this healthcare reform by eliminating parts of that. Didn't work out for them, but I think that's where you got to start.
That's a pretty highbrow answer, meaning you have such.
It's not going to happen.
No. Meaning, meaning you have such high regard. You have because I know you well enough, David, to know there are wheels turning in your mind here. You have in your head some model whereby a president or a presidential candidate can start a conversation. Doing what? Encouraging people in academia who are like-minded, such that 4 or 5 years you can bring by giving a speech you can bring something into the realm of political reality within a few years.
Think about the conservative movement that you were most affiliated with President Reagan. That didn't start in 1980.
It did not.
It started quite a while before with a candidate, with then Governor Reagan talking about those things, other people pushing those issues. The ideas of Milton Friedman, those ideas came to a point when in 1980 it appeared clear that the government, that we needed to cut back. The government wasn't going to solve all these problems, as had been stated, and you got some action. It seems to me that you really only get these kinds of solutions when the problem really gets bad. The problem with healthcare is it's not quite that bad. You got, just like you said, enough people say, I'm pretty happy with what I've got. Then you propose something that's going to change that. That's harder to do because, what happens to the status quo? But the status quo over time will get worse because costs are not going down.
Okay, so democracies can only make major adjustments in times of crisis or near crisis, and what politicians, right-minded politicians and intellectuals such as the two of you should be doing right now is laying the predicate such that there is the intellectual groundwork when the crisis comes. Is that right?
I think that's certainly a true statement, but I don't think that excludes pursuing other more incremental avenues for changing the system. I don't think we have to wholesale throw out the employer exclusion. For example,
Give me a couple then.
For example, one thing that John Cogan, Glenn Hubbard, and I have proposed is extending deductibility to all healthcare spending, not just employer-sponsored insurance.
So if you can't repeal the tax-favored status of employer-sponsored, you give it to everybody.
Give it to even out-of-pocket spending, which would at least level the playing
That's an
field
improvement.
between insured and out-of-pocket spending and start to get people out of their terribly inefficient low-cost sharing health plans. Another thing you can do, which some of the Democrats and Republicans in Congress have now been talking about, is gradually erode the employer-sponsored exclusion. Put a cap, start to tax very high-cost plans and let that level move down with time or only increase it at the rate of the consumer price index as opposed to the medical price
My
index.
view is these are tactics that ends up with the strategy being that deduction is gone in the long run. That's a tactic. If you can start with those things in the long run, it's the
President Obama and the current healthcare debate just at the moment dominate the media, but you two watch this carefully. Are there any politicians at the national level, governors, who get this, who are talking, politicians, I know they're intellectuals like you guys, but do you see anybody?
I know that in Florida, then Governor Jeb Bush and now the governor of Florida has been experimenting with Florida's Medicaid program and has come up with some interesting findings from there. Governors all throughout the country, both Republicans and Democrats, have been experimenting with their Medicaid programs because, frankly, they've been just pushed to the brink on the cost front. And so you do see stuff coming out of there. I think that Charles Grassley, obviously a very smart guy, has been working on
Iowa.
Senator from Iowa, been working on this issue for a very long time. There are people from both sides of the aisle that understand what's going on here. I think the problem is that the Democrats have boxed themselves in to conflicting goals that just can't all be achieved. Namely, getting costs down, getting complete coverage. They both can't happen.
Okay.
And the Republicans, in my view, demagogued the issue in some sense and not offered alternatives that...
in Congress, in Washington, you're saying.
Yeah, I agree with Dan that the innovation
true.
will come in the states. The innovation will have to come. In Congress, it's just too hot. It's too now. They can't afford to sit back and say, oh, in the long run, this is what I'm in favor of. They got to be either for it or against it.
Right. Okay. Segment 5. We've been talking about President Obama and what he thinks he's doing on health care. Economist and lawyer, political scientist, I would like to discuss the enigma of our chief executive in a couple of other areas. And in 2 or 3 issues here, the underlying question will be the same. What does he think he's doing? What does he understand himself to be doing? He assumes office during the worst economic crisis since the recession of 1982 to 1983, and he calls for a stimulus package, President Obama, then permits the Democratic leadership of the House to draft the package, ending up with almost $900 billion in spending, only a very small proportion of which will be spent within the next 2 years and could therefore possibly represent a stimulus. Of that, even a smaller proportion is actual spending that economists would call stimulative. Overwhelmingly, it's transfer payments and pork. Overwhelmingly, it's 2 years and further out. What did he think he was doing?
Not being inside his head, of course, I can't say.
Take a shot at it.
I have no idea. I mean, what's clear, everything you said about the stimulus package is completely right. I think that it's unfortunate it turned out that way. But I think Congress would have acted no matter what the president did. I think the Democrat-controlled Congress saw this as an opportunity, and whether the president made it better or worse, it's hard for me to say.
My view is the Democrats, essentially the left in the Democratic Party has been out of power since 1980. And you might even make a claim that it was 76. Carter was a Southerner, and Bill Clinton came into office as the leader of moderate Democrats and passed welfare policy, signed whatever it is. The facts are they have not felt they've been in control until 2008. And they were going to pass that bill. They had been waiting, David Obey of Wisconsin had been waiting for 14 years to pass that bill, and he finally had the votes.
Obey of Wisconsin, the Speaker Nancy Pelosi of Northern California, Charlie Rangel of Harlem, Henry Waxman of Beverly Hills. These are liberal folks from liberal districts.
Absolutely.
They weren't waiting around. I think the president, I don't know whether the president liked it or not. I don't think he had a chance.
How do you grade the chief executive's performance in that, though? Do you mean to tell me, it seems to me it could be argued that the whole point of making Rahm Emanuel, congressman from Chicago, your chief of staff, is to indicate to those liberal lions in the House, I'm in control, not you. Rahm Emanuel is going to ride herd on you. Was that simply impossible? The president did the best he could?
Rahm, I don't know if he did the best he could, but Rahm Emanuel, nobody rides herd on the House of Representatives and the Senate, because in the United States of America, so compared to the British or the German party system, your career in Germany or Britain depends upon what the party leader thinks of you.
Right.
And that's absolutely untrue in the United States. In the United States, the connection is directly between the representative and his or her constituency. And if they want to, think of Phil Gramm. Phil Gramm comes in, he's a Democrat. He votes, Democrat of Texas, College Station, votes more with President Reagan in 81 and 82 than anybody, even the Democrats. And so the Democrats strip him. They say, okay, you can't be on the budget committee. He says, bye-bye, resigns his seat, goes back home and wins as a Republican. That doesn't happen in Germany. It's not, so the connection's direct with the voters, and the president can't push him around too far.
So the leadership...
One last thing. What's the president going to say to John Dingell? John Dingell could say, gee, I was here last year, Eisenhower. He could go through a list of about 13 presidents. So I'll be here when you're gone, Mr. Obama. So don't tell me how to vote.
Why did John Dingell lose to Henry Waxman in the...
Wasn't liberal enough. On the environmental issues, Dingell was a Detroit guy and had for years blocked every time under CAFE standards, the corporate average fuel economy, to increase the amount of miles. He'd fought it and won.
When Ronald Reagan was president, there were many conservative Democrats in the House of Representatives. Yep. Are you arguing that the Democratic Party in the House has become dramatically more liberal?
There are very, very few liberal, there are very, very few conservative or moderate Democrats, and there are very, very few moderate or liberal Republicans in the House.
Okay, so the parties have shifted themselves, sorted themselves out in the last quarter century on ideological lines. Yes. To be a Democrat now means to be a liberal. That's much truer than it was.
Much truer. Exactly.
Okay.
Exactly.
All right. Back to health care. I see here, earlier I said it was 87% of Americans in Gallup polls who say that their health care is good to excellent. Turns out it's 83%.
Yes.
I got that wrong. It's 83%.
83%.
Give us a little bit your sense of what's going to happen. David has just told us that in the House of Representatives, the president gets pulled where the leaders want to go. Therefore, it seems plausible to suggest that in the House, we'll come to the Senate in a moment, in the House, we're going to get a great big federal government extends its control of the healthcare system bill. It will move to the floor and it will pass.
That wouldn't surprise me. The median House member is far more liberal than the median Senate member. It's the Senate, though, where the rubber will meet the road, where the constraint will be, and it will be somewhere around that 60th senator. Just to come back to that for a moment.
And where is the White House in this? Where is the president in this?
Well,
You've almost made an argument, David, that Nancy Pelosi is running the country.
No.
She's managing the House.
Okay.
Yeah, I wouldn't say that either. I mean, they're supporting the efforts of congressional Democrats, and obviously they're going to sign something. The president will sign something if it meets the standards that he's set out. But it is in the Senate where the rubber will meet the road. What will happen? It's very hard to tell. I think they will get a bill. I had previously thought that it was possible there'd be no bill. Dave has convinced me that that's impossible, that that's very unlikely, that the president...
He must have a bill.
The president and congressional Democrats have just staked too much on it. But there's room to do stuff short of a huge new entitlement program. There are Medicaid expansions that you could easily see that happening. New insurance regulation, pre-existing condition exclusions bans, things like that. I definitely can foresee something like that. I think the public option is now officially dead.
I agree.
And
David, play it out.
I think it's dead because they don't have the votes. They can't. I'm not even sure. They may get it through in the House. They may not. Depends what the Blue Dogs do. But in the Senate, they're just. I don't even think they have 50 votes for the
public.
You got Conrad, and you got the North Dakota, South Dakota, and then you move down, and you got Arkansas, Louisiana, and Nelson, and Nebraska. It's just not possible for those guys to vote for that huge. For example, if that public option program passed, every hospital in North Dakota would close. And the reason being because they have a
Republican
program.
state that happens to have 2 Democrats in the Senate.
Yeah, it just is not.
And a very popular Republican governor breathing down their necks. Okay.
Exactly.
So give me your best. You can even resort to probability distributions if you want to as a political scientist. What do you think is going to happen with regard to health care?
I think they'll get a bill, and I believe that bill will have some of what Dan said, expanding Medicaid, but I think it will have state options. And I want you to note that the amendment passed in the Finance Committee to allow the states to establish their own not-for-profits, like North Dakota and these other states have. I think it'll be much more toward the direction of these not-for-profits, which may not be such a terrible thing if they're managed well as they are in some states. But you have to see the details on it. They will not get a public option.
And the president will take this to the public. He'll sign it. He'll take this to the public and declare victory.
Of course.
And the left will be furious. They have nowhere to go. They'll support.
Well,
him.
You see the blogs all the time, and the blogs are jumping up and down. Obama is in. Bob Hurd in the New York Times is always Obama doesn't get it. But when I look at the breakdown of what's happening in public opinion, where the president's gone from about 60 to 51 or 52, which is about where he should be.
Job approval rating.
Yeah. Republicans about 3 months ago, 4 or 5 months ago, the Republicans bailed out and said they don't approve of his job. Democrats are still at 90%, 88, 90% in favor of Obama. It's the independents who swung slightly against him on job approval now. And that's where the battle's to be fought. The bloggers are, it's like listening to Rush Limbaugh and Glenn Beck and Keith Olbermann and so on. It's great. It's good entertainment, but that's not where the action is.
Got it. David Brady and Daniel Kessler, thank you. I'm Peter Robinson for Uncommon Knowledge. Thank you for joining us. And again, please follow us on Twitter, twitter.com/UNC Knowledge. Send us what you think of the show. Thanks.